Thank you so much, Dr. Toliver, for participating in this interview to inspire and inform the next generation of Douglas physicians. To begin with, why did you choose family medicine? And if you could go back, would you change?
Okay, so thank you for inviting me to participate today. So I chose family medicine because I like the idea of being able to care for patients throughout their stages of life. We can see patients from when they're born, before they're born, to all the way to the end of life. And in my rotations in medical school, I liked that the family doctors had a really good rapport and built trust with the patients and really almost became part of the family. And I really liked that, inclusiveness into every patient's lives. And I would not change it. I love family medicine. One, because of, being able to care for patients at different stages, but also we do a little bit of everything. We do primary care, we can do urgent care, we can do, surgery to a certain degree, not surgeries, but surgical procedures to certain degrees if you have, extra training. You can do sports medicine if you have extra training, emergency medicine if you have extra training in that. There's so many opportunities and I wouldn't change it.
That's awesome. How do you manage work-life balance?
So I try to make sure after the work is done that I really try to focus on myself. So after the work is done, it's not just seeing the patients, it's finishing the documentation, answering any phone calls or messages, going over labs and studies. Once that's done, I close the computer down. It's time to rest. So either go for a walk or do some type of exercise, read a book, something to really kind of turn my mind off of work. And also in the practice I work in, we have group practice. We all work 4 days a week and every other Saturday morning. So we have one day where if you have some extra time, you can go through some of these labs and answer calls, but really it's a time to really kind of just recharge for the rest of the week. And we have a call schedule, meaning that, there's always somebody available after hours to answer any urgent messages. So that way each of us doesn't have to worry about that every single night. And vacation is very important. So we always have at least 4 weeks of vacation. So I always try to take at least maybe every 3 months, take, a week to just kind of recharge and refocus. And really, it's important to do things outside of work. Otherwise, we become very burned out. There has to be a time to rest.
That's very true. How long did it take for you to pay off your loans or are you still paying them off? Also, what loan programs or options are available if you do know?
Yes, so I am still paying loans. So I'm in an income-based repayment program, meaning you provide your salary and proof of salary, and then the loan company will determine how much you need to pay each month until your loans are completed. But there are also some loan repayment programs. So if you work in an underserved area, meaning an area that where there's limited medical care, a lot of states have a repayment program where they give you a certain amount of money that they send directly to your loan company once a year, well, for a certain amount of years. And then there's also a loan forgiveness program with the with federal loans. So if you work in a public service, so such as government or VA or even student health or a nonprofit organization, after 10 years of paying consecutively every month, you should be forgiven. So it's not just that you have to pay. There's other ways to be able to pay. Mm-hmm.
Yeah, that's a really scary concept. So I'm really happy you shared that.
Yes.
Yeah. Would you say that your salary currently makes the journey of medicine worth it?
I think so. I mean, I think a lot of us going into family medicine, especially primary care, we know we're not getting the highest salaries as far as the other specialties. I think being, doing what we do as far as kind of coordinating care and really being one-on-one with the patient more often and spending more time with the patient really makes it worth it. So you almost become part of family sometimes. So for me, for what I do, I'm comfortable. I'm not worried about money. So for me, that's important. And, a lot of the higher specialty, higher paying specialties, there's also some more responsibility. So, for me being on call, all I have to do is bring my phone with me, make sure I have access to the electronic medical record. Some other specialties, they have to go to the hospital whatever hour, have to do procedures at whatever hour, so either with higher salary comes other responsibilities as well. So for what I do, I'm very happy.
Thank you. How was your journey through medical school?
So journey through medical school it was a lot. It's a lot of focus. Really, you need to focus and, keep your eye on the prize, because it can be very difficult. It can be, you spend many, many hours studying. You really sometimes wonder, is this what I really want to do? I definitely during medical school had some of these moments of self-doubt. Is this what I want to do? Am I good enough for this? Am I going to pass this exam? So, you have to really be wanting to do this and being able to face all the obstacles, because there are definitely obstacles that come along.
After receiving your bachelor's degree, did you take a gap year? Why or why not? And can you share any pros and cons for doing so?
So after I graduated, Douglas, I was not 100% sure I wanted to go to medical school. I was pretty sure, but I wasn't really 100% sure. So I decided to go to a master's of biomedical science program, which was at Rutgers, well, now Rutgers, but then it was UMD&J in Newark. So it was a 2-year master's program. And we're even given the opportunity to take a class with the medical students to really see, is this something we want to do or not? So for me, it was the pro of that was being able to almost get like a sneak peek of what, I would be experiencing. As far as the con, that was a couple of years where I had to, I pursued another degree, extra loans. But in the end, I'm glad I did it, because it really helped me solidify my decision to go to medical school. And I had a better idea compared to some of my other, classmates of what to expect, because I've actually been there to a certain degree before.
We spoke about challenges a little while before. So as a pre-med student, did you face any challenges pursuing this route of medicine?
Oh, yes. So one, again, self-doubt, lack of confidence sometimes. Courses were difficult sometimes, and sometimes wasn't sure if I would get through. Also some anxiety, and sometimes my academic performance was affected by that. But, I was able to push through that. And then also, some professors and some, advisors were not very supportive. I mean, many were, but there were some that were not. I think a lot of people I've talked to, and a lot of my classmates have been told, you're probably not going to make it.
Oh,
So
wow.
the people that have listened to those people, wouldn't be anywhere. So, you have to really, again, the main focus is, if you really want to do it, you have to be willing to do it and deal with all these challenges that are, put in front of you.
That is so encouraging. Thank you for sharing that.
Yes.
What is a common mistake you see pre-medical students make?
I think one of the biggest mistakes, and something I wish I would have done, was majored in a major that I actually enjoyed. I feel like a lot of medical students feel like you have to do biology or some type of science to be able to become accepted to medical school. And that's not true at all. The main thing is, you want to be well-rounded, and you want to, of course, do well in the prerequisite classes. So if you're sometimes in a science major, there's some classes that are very challenging, and you can maybe focus more on those prerequisite classes and doing really well in those. But also, yeah, you want to do something that you enjoy. I enjoyed art history and English. I wish I had pursued that more and focused more on the prerequisites. I think I would have been a stronger applicant if I had done that. And also, I would definitely should have done a review course, or a proper review course for the MCAT test. I did a lot of studying on my own. I can read a book, I can figure it out on my own. But I wish I had done a more structured review program.
The MCAT is definitely a beast to overcome.
Yes.
What is one piece of advice you could give to pre-med students?
So my biggest piece of advice is to work very hard and do the best you can to be able to get the highest grades you can. And very important to ask questions. If you're not clear in the material, make sure you get your clarity. And it's good to go to the office hours of your professors to get the clarity and make sure you're doing as good as you can to get the highest grade possible, but also you can get some good recommendation letters from those professors that see, though, this person's really trying and really wants to learn. So definitely work as hard as you can.
Well, that is the end of our interview. Dr. Toliver, thank you so much for coming out and speaking and sharing your testimony of the Sprout of Medicine. I know I'm encouraged, and I'm positive other students will be encouraged as well. So thank you.
You're welcome, and thank you for having me.
Absolutely.